And let's stay with health, and health workers stand to benefit greatly if a proposal by the Building Bridges initiative for the establishment of a health service commission is adopted. Lack of a credible commission to address challenges facing health workers has led to strikes over the years, with thousands of patients forced to seek medical attention from expensive private facilities. The constitution-making process critically left out the formation of a health service commission, which would be the equivalent of the Teachers Service Commission. Let's now speak to Seth Panyako, who is the Secretary General, Kenya National Union of Nurses, who's speaking to us from Mombasa. And many thanks for joining us this morning. Perhaps let's understand, if established, what functions would the commission, the Health Service Commission, take on, and how would this change how the health sector in the country operates?
First of all, Linda, we want our Health Service Commission to be like the Judicial Service Commission and not the Teacher Service Commission. Because the Teacher Service Commission is not having a representative of the workers. And that is why you have many illogical decisions being made. So we want a commission that looks like the Judicial Service Commission, where we as the key stakeholders are involved in decision-making that affect the healthcare system of this country. The function of the Health Service Commission will be one, to recruit, to deploy, and to transfer health workers. It will be to discipline health workers, training of health workers, equitable distribution of health workers, especially those with highly skilled health workers, like the specialized medical doctors and highly specialized nurses. There are certain counties like Mandera, Wajir, Isiolo, that do not have highly specialized medical doctors because they do not want to go and work in those countries. Health Service Commission is going to ensure that every Kenyan, wherever he is accessible to quality, affordable, available, technologically sound, and socially acceptable healthcare services. It will also deal with the promotions of health workers, and it will reduce the industrial action, as you have rightly stated, by at least 75%. Because after devolution, we have had 444 days that has gone into industrial actions. That is about 1.5 years that Kenyans did not receive services. And this is attributed to lack or not payment of salary on time. 75% of this industrial action have been because the county governments have been messing up their budgets, eating into the recurrent expenditure and failing to pay salaries on time. So one of the things that the Health Service Commission is going to do for this country is to cut and reduce the number of industrial action by 75%. We are going also to benefit from harmonization of terms and conditions of service across the country. What we have in this country is that some people are earning astronomically high salaries, and yet they are working in the same environment, they have the same equal academic qualification, the same experience, doing the same thing, regulated by the same body, and yet they are earning different salaries within the public sector. That is one of the things that we believe the Health Service Commission must and should address immediately, put in place.
Right, and you've mentioned you actually have particular numbers. Of course, many people are of the opinion that this independent commission will really improve, the operations in the health sector in Kenya. But just so we have a clear understanding of when you speak of numbers like industrial action will reduce by 75%, how did you arrive at this, and how do you get that commitment that there will be a change?
We took the analysis of the causes of industrial action from 2013 up to June this year. And when we were doing when I attended the conference on National Wage Conference by SRC and KICC, where I was one of the panelists, it emerged clearly that our industrial actions has eaten 444 days between 2013 and 2019 June. And then using those days, we looked at the causes of those strikes, and we found out that 75% of those days we were outside were related to non-payment of salaries and disparities within the health sector, where workers have gone out to say they want harmonization of terms and conditions of service, where workers have gone out and they say they want to be paid the salaries that the counties have not paid. So we have analyzed that and we have tried to put them into ratios. The remaining 25% centers about better working conditions, improvement of the terms and conditions of service for workers, improvement of infrastructure, supply of medical equipment, having sound health management systems, and those kind of things take about 25%. But a bulk of it, after devolution, has been about non-payment of salary.
Right. And you've touched on the HR function, so to speak, regarding the handling of health workers and what have you. What then stands to be the benefit also for the public in terms of, we've also witnessed cases of negligence where, access to medical, health service is concerned. Would the commission also be involved and improve, self-regulation in the sector and also matters to do with disciplinary control?
If you asked me, my recommendation would have been, we shall have the Health Service Commission that will be charged with the responsibility of keeping a roll of all health workers in Kenya. And the bodies charged with the responsibilities of regulations become departments within the Health Service Commission, so that we have a well-coordinated regulatory bodies, because regulatory bodies are the ones who are charged with the responsibility of maintaining standards, disciplining of health workers, and therefore if they are not linked to the Health Service Commission, we are going to have a gap in between. We as health workers, why we are insisting that we want a Health Service Commission that is like a Judicial Service Commission and not like the Teacher Service Commission, is because we are going to be in the center and participate in the decision that affects healthcare delivery in Kenya, so that if a mistake happens within the healthcare system, there will be no blame game. All of us will take responsibility. The government will take our responsibility, and the health workers will take responsibility, so that there's a sense of ownership. We don't want a body that is sitting there, looks like belongs to government, and we are away. Because when you look at the spirit of the Constitution was that there should be public participation, and therefore the only way we can participate in decision making in the healthcare system is that we must be part and parcel. We must have representative on the Health Service Commission. One of the benefits that's going to go down to the public is that we are going to have a well-coordinated healthcare system. If money has been set aside for a particular function in the health sector to improve, it will be channeled through the healthcare system. Unlike today, when you look at the conditional grant, and if you do a research for yourself, you realize that conditional grant is given to level 5 hospital by the National Treasury. But when the money goes to the county government, they take that money through their budget system, and the money does not get to level 5 hospital. There is one particular hospital that was given 336 million in the last financial year. That hospital, that county government only took 16 million to the level 5 hospital, and the status of the hospital have remained pathetic. So we are saying that there shall be a body charged with the responsibility of managing health and ensuring that the management of health does the right thing, and you can actually face it and you can challenge it on anything within health sector, especially on human resource.
Right. Many thanks for speaking to us this morning. Seth Panyako is the Secretary General, Kenya National Union of Nurses, just adding his voice to that recommendation that was put forth in the BBI report, recommending the formation of a Health Service Commission, an independent commission at that.